Hello. In this video I'm going to give a brief summary of an article that myself and colleagues have published in the BJ Psych Bulletin. The title of the article is The Mental Health of Doctors During the COVID-19 Pandemic. Myself and the co-authors have been researching the mental health of frontline professionals for some years now, and much of our research has focused on doctors. And in particular, we found that not only are doctors prone to stress and mental health difficulties, they're also reluctant to seek help for those difficulties. And in many cases, this reluctance stems from a fear of stigma and also worries about career prospects. We decided to write this article because we recognised that the COVID-19 outbreak presents a significant challenge to the mental health and psychological well-being of doctors and healthcare professionals generally. Although many doctors would already have been managing stress and mental health problems prior to COVID-19, research from previous pandemics suggests that such crises are associated with increased psychological morbidity in health professionals. This can include symptoms like trauma, suicidal ideation, depression, and so on. And these symptoms, so research shows, can sometimes endure for a long time after the health crisis has subsided. So of course, in a pandemic, the stresses placed upon doctors are far greater than normal. They can be working longer hours and working much more intensively. Doctors are also placed at greater risk, of course, because they're in closer contact with the patients who are infected. And sometimes in acute health crises, resources can become scarce, and because of this, doctors might not have access to appropriate equipment, including personal protective equipment, which of course adds further stress to the work that they do. An additional stressor is that with infectious outbreaks like COVID-19, by extension, doctors' families are at greater risk too. Now this can be mitigated to some extent by physical distancing, but this deprives doctors of a crucial social support network just when they need it the most. We argue that there are significant mental health risks for doctors during the COVID-19 outbreak. Our article highlights some of the factors that healthcare employers and healthcare professionals should be mindful of in order to protect against these risks. We discuss the importance of employer support and employer recognition for the work that doctors and healthcare professionals do. That can be really protective and especially important given that health professionals during the COVID-19 crisis are showing such a strong obligation, professional obligation, to look after their patients in spite of the personal risks in the work that they do. We also highlight the need to tackle mental health stigma in the workplace and ways to facilitate mental health help seeking within the workplace. At the individual level, we also recommend mindfulness practice as a stress management tool, both because of its flexibility for use in the workplace and also because of its very strong evidence base. And we hope you find the article useful.